A controversy that has been around for several decades. The use of a tanning bed has developed into a much bigger problem in today's society. It has become a popular belief for women of all shapes and sizes that the only people who are beautiful are dark. Contrary to common belief that tanning is not very harmful, it has been proven that tanning is very detrimental to those who partake in this dangerous activity. Because many people do not know this fact, tanning continues to be an exponentially growing fashion trend. This trend was one that was developed by a single person. A tan became fashionable in the 1920s when Coco Chanel developed her tan on a cruise aboard the yacht of the Duke of Westminster. Ever since then, a good tan is a must for an outfit to be perfect. The side effects, however, can be deadly. People should stop indoor tanning in order to stay healthy, lower the chances of skin cancer, and avoid the trauma from cancer. It has been scientifically proven that staying away from indoor tanning could help an individual stay healthier than those who tan regularly. People who maintain a healthy lifestyle aside from tanning are highly likely to develop a skin cancer. This can cause people who are regularly healthy unhealthy. They can become ill, and in the most serious cases, they could potentially develop a harmful disease such as skin cancer and die from it. Yet, Joseph Levy states in Teen Vogue magazine, beds provide vitamin D as well as a cure for seasonal affective disorder. Still, it is a known fact that skin cancer is still a risk for every American who tans. The Gutman article uses the oversimplification fallacy, stating that tanning gives you vitamin D and vitamin D prevents cancer. Today, more than 1.3 million new cases of skin cancer appear in the U.S., and 60,000 cases of malignant melanoma contribute to the death of more than 10,000 Americans every year. This is a drastic change since before tanning became the most popular to most all Americans. Avoiding tanning beds will help the individual that chooses to do so stay healthier than most other Americans. Staying healthy by not tanning will also help to change the image of beauty in today's society. If Americans would stay out of indoor tanning beds, their chances of skin cancer would lower drastically. People that tan regularly are 2.5 times more likely to get skin cancer at some point in their lives. Excessive sun avoidance leads to hypovitaminous D and an increased risk of multiple types of cancers. But excessive skin exposure will lead to multiple types of skin cancer. In the Gutman article, they use the red herring fallacy to compare sunbirds and tanning, saying that only the sunbirds cause skin cancer, not the tanning. With all the healthcare policies that are being implemented in today's world, this would decrease the cost of healthcare for many Americans. The health of society would be dramatically improved if people would refrain from indoor tanning. Lowering skin cancer chances would also help with the trauma people face when they find out they have skin cancer. Because excessive tanning leads to skin cancer, many Americans today are facing traumatic situations in their daily life, such as wrinkly skin, skin spotting, and extreme development of skin tags. Dr. Bruce Katz says, "I have patients in their early 20s with dark spots on their face, chest, and back from tanning parlors, proving that over-tanning causes damage to the skin. It makes you look skinny. Plus, my boyfriend tells me I look good tan, which makes me feel like I ought to do it," according to one American woman. But look good or not, you're at a higher risk to develop skin cancer. In an article from Teen Vogue, they use the non sequitur fallacy that states, "I've burned myself a bunch of times, but I'm a kid, so it's not that big of a deal." Tanning is becoming a trend at a much younger age than it was 20 years ago. This is causing patterns of skin damage in young women. By 18, 80% of your skin damage for your entire life has been done. Exposure to UV rays before the age of 20 is strongly correlated with basal cell carcinoma, the most common form of cancer in the U.S., and melanoma. When women find out they have skin cancer and notice the spots on their skin and the wrinkles, that's when they begin to freak out and the trauma sets in. If a woman has skin defects, she has a lower chance of having self-confidence. A woman with no confidence won't get very far in the society we live in. A woman with a lack of confidence is often a person who gets into harmful relationships and other situations that are often detrimental not only to their physical health but their mental health as well. People should stop indoor tanning in order to stay healthy, lower skin cancer chances, and avoid trauma from cancer. If people would avoid indoor tanning beds, they would stay healthier all around and lower their chances of developing skin cancer throughout their lives. Lowering the chances means less people would have to deal with the trauma that skin cancer and the effects of it brings with it. If Americans would at least try and stop using indoor tanning salons, they would help themselves out in the end. Skin cancer can be a very serious problem, so if you have the chance to keep it from happening, take the precaution.